Urogynecology deals with incontinence of the bowels, incontinence of the bladder, and reconstruction of the vagina. We see mainly pelvic organ prolapse and incontinence of urine in our practice. Our patients are a diverse amount of ages, from the youngest patients that we've seen are in their teens up till the 90-year-old woman who comes in with incontinence or prolapse that's bothering her day to day. I think people don't want to suffer in silence anymore. I think this was a very stigmatized issue in the prior generations, talking about incontinence and prolapse, and people are a lot more comfortable talking about it these days, and they don't want to be dealing with this on a day-to-day basis when they know that with an elective surgery they can take care of it. I think that just by talking to people and explaining how prevalent this is, that 1 in 3 women in their lifetime will be diagnosed with a pelvic floor disorder of some sort, and letting them know that it's very common and treatable. You know, for incontinence, it's leaking urine with cough, laugh, sneeze. That's stress incontinence, and the other type of incontinence is urgent incontinence, where you feel like you have to rush to the bathroom right away, or you leak, or you do leak. Sometimes there's triggers to urgent incontinence, like the sound of running water and things like that. And then prolapse is more, I feel like I'm sitting on an egg, there's a lot of pressure in my vagina as I stand through the day, and gravity pulls on that prolapse, that it gets worse and worse. There's many behavioral solutions. For prolapse, there's pelvic floor muscle exercises, commonly known as Kegels. Physical therapy, we have female pelvic floor physical therapists who work with us frequently to strengthen those pelvic floor muscles. There's a pessary, which is like a donut shaped device made out of silicone that fits inside the vagina and holds everything up. And lastly, there's surgical therapies for prolapse. And for incontinence, it's many of the same treatments, behavioral treatments, trying to avoid caffeinated beverages and coffee, bladder irritants and whatnot, and up to surgery as well. I mean, I think that right now we've opened this gorgeous facility in Lone Tree. We can get you in the same day when you call for an appointment. We're the largest urogynecology practice in the state of Colorado. We all have a very evidence-based focus. These aren't problems that necessarily get better with time. They either stay the same or get worse over time, and so I really encourage people to come and chat with us, just find out what all the options are for treatment.